Yeah, so as I'm sure I'll talk about at some point on this podcast, a lot of my work is really influenced by Black feminists, and I use that word really broadly. I think there are the traditional scholars that we ascribe to that label, and there are other folks who preach and practice Black feminist theory and Black feminist thinking, but aren't necessarily published or formalized in the literature like that. But I think a lot about Toni Morrison. She has a quote that I'm not going to attempt to recap right now because I'm going to say it wrong. But it basically, essentially, is about, the role of racism is distraction. And so I think in applying that to the work that I do, the spaces that I exist in, and the communities that I care about and I'm passionate about. I don't dismiss the legitimacy of racism, but I don't expend extra energy um, on proving that it's real, because that within itself is inherently a distraction, and it's a distraction from the work.
Well said, well said. And we love a good paraphrase, by the way.
Yes.
No, but that's so true. And I listen or watch, I should say, FD Signifier. He's a video essayist on YouTube, and I remember him saying something similarly. Like he doesn't debate. He talks a lot about like race and Black culture, and he talks about like how he doesn't like debate racism because it just like to your point, it's like what is that doing for me in like in the bigger picture of getting forward and doing the work. So appreciate that sentiment, and I hope that other people can really maybe work towards that so that we are just doing the work as opposed to talking about things that we have established as like facts um for a very long time.
Exactly. It's definitely hard. I will say that I did not get here overnight, but I think that there's just better places to put your energy.
Love it. And I'm not going to ask you on the spot, but Black feminism, like literature that you would recommend, definitely send that to me afterwards, and we could put that in the show notes. I would hate to put you on the spot for that right now, so, but we can get
Yes, let me think about it.
awesome. So, given your background in health services research and policy, what systemic changes do you believe are necessary to achieve equitable access to healthcare for all individuals, regardless of race or socioeconomic status?
Yeah, so a lot of my work is specifically influenced by reproductive justice. And so, for folks who are listening that are not familiar, reproductive justice is a theory, it's a movement, it's a framework. It was coined 30 years ago by 12 Black women, and they essentially did not see themselves being represented in the mainstream feminist movement, reproductive rights movement. And this was also around the time that healthcare reforms were being made, and they didn't see themselves represented in that. And so they coined reproductive justice, which has four main tenets. It's based around the human rights frameworks, and the tenets are everyone has the right to have a child if they want to have a child. Everyone has the right not to have a child if they do not want to have a child. Everyone has the right to parent that child or children in safe and sustainable communities. And then everyone has the right to bodily autonomy. And what I love so much about this framework is that it can truly be applied to anything and everything. Like everything is truly a reproductive health issue, a reproductive justice issue. And I like that reproductive justice goes a step further than reproductive rights because it doesn't just focus on the legality of things. Like it's great if abortion is legal, but if people don't have access to it, then what does that mean? And reproductive justice calls us in to really think about those additional barriers. And so I think in my work, I have spent a lot of time really thinking about what does healthcare access mean? And what does it mean if our lever of change is not just policy? Because, right, we have policy, and that policy is keeping a lot of these oppressive systems intact. And so that is where I spend a lot of my time, a lot of my brain space. I do a lot of maternal health work. My previous stuff has done a lot around maternal mortality and a lot around doula access, and that's a space that I'm still in right now. And so it's really just thinking about new and innovative ways to reimagine what access is, how to measure that, how to research that, how to evaluate that, and really how to put it into practice.
And if you met someone that was out in the field talking about reproductive rights and maybe you wanted to have that conversation with them to focus the conversation more on reproductive justice per se, what would the framing or how would you kind of approach that conversation?
Oof. Okay. This is not a question I've ever been asked before. I think the biggest thing is to meet people where they're at. And so, I think reproductive rights is a stepping point for a lot of people just because that's more so kind of the mainstream rhetoric that we see. And so I think I'd approach it of, hey, have you ever heard of reproductive justice? If they haven't, I would give them the history. There's definitely recommended readings, both books or just smaller, shorter papers. There's YouTube videos. I truly think reproductive justice is a framework for everyone. And so, yeah, I think you meet people with where they're at, whatever reproductive health issue that they're interested in, put that into the framework of reproductive justice, show them how that's a more helpful framework, and then you go from there.
Love it. Simple. And I think it always does naturally go back to like meet people where they're at and try to give them information that kind of gives them contextual sense of what you're trying to talk about. So appreciate that. So your work in academia, how do you see research institutions contributing to tangible changes in healthcare systems, public health systems to address racial inequities?
Mm. Omari, you're trying to get me in trouble here. Um, yeah, I think academic research is a really interesting place. Obviously, I have situated myself here because I think it does, allow us access to certain resources. But I also, too, am equally as critical of this space, and the history and the harms that is has caused to certain communities. And so I think for me, I do believe that there is a power in research. I do believe that there is a power in knowledge production and knowledge sharing. And I think situating yourself with academic language and with those resources can be helpful. Um, and so, in thinking about it broadly and thinking about, actual tangible change towards racial inequities, I think for a lot of people, unfortunately, 2020 was the first time that they were awakened to any of this. And with that, we saw a lot of, funders really open their pockets too. We saw a bunch of health equity initiatives, whether that was call for papers or grants or what have you. And while that was super exciting, it's really interesting to be here now, 4 years later, and to see that a lot of those opportunities have closed. Some still exist and have been more fleshed out, and that's super exciting that, health equity is now being built into the mainstream conversation. But then there are other places and spaces where, yeah, racism was solved. We did that, and it's on to the next hot topic. And so that's frustrating. Um, but I'm now steering from the question. But I think it's really comforting that there are a lot of us in the space who do have common goals, are working with each other, are collaborating, reaching across the aisle, and are really pushing for both our research and our our topics, our passions to still be a priority. And then on the flip side, folks who are also actively disseminating their research, so not just letting it be a paper, but following it, whether that's policy route or whether that is other more grassroots efforts. So I think there are pockets um, of places where people are trying to make change, and that is exciting to see. It's not perfect, but you can make that argument about anything.
Right, right. There's always the vessel for us to do the work, and there are always pros and cons to all the institutions and systems that we exist in. And I think
Yes.
to the point of like knowing what your goal is within the system, as well as knowing how you can gain the knowledge and the skills for you to do the work and the things that you ideally want to do.
Yes. And at the end of the day, academia is another institution, it is another system. And I do think to do this work and to do this work correctly, it does require us to also be critical of that and to acknowledge our roles in that and to use whatever power we may have, and that looks different depending on what stage you're at, um, to try to, protect those that have lesser power than you. So it's not perfect, it's a work in progress.
Right. And it is our job, I feel like, to beg the question of the things that are around us. How can they serve us better? How can that, especially the things that are built to serve us in that sense.